Hi, my name is Brittany Williams, and today I will be performing tracheostomy care on a patient that currently has a trach. So first, I will knock on the patient's door, step in, close the curtain to ensure patient privacy. I will then perform hand hygiene. I will ask the patient their name and date of birth, and then as well as checking their wristband. I will then explain to the patient the procedure that we're doing today and gain their consent to do so. Once I get their consent, I will raise the bed to appropriate height level for myself, and I will place the patient in Fowler's or semi-Fowler's position. I will also pre-oxygenate or pre-oxygenate and suction if needed. And then I'll begin setting up my supplies. So I have clean gloves, trach care kit. We also have sterile normal saline and a soaking solution of hydrogen peroxide. So I'll begin by opening my supplies, placing my sterile gloves to the side. Placing my sterile field. I will then pour the supplies onto the sterile field. I will then pour the sterile normal saline in 2 areas of the tray, and then the other area will pour the soaking solution of the hydrogen peroxide. I'll perform hand hygiene again, put on my clean gloves. Okay, then we will unlock and remove the inner cannula very slow. And we'll place that in the soaking solution. Then we will remove the soil dressing and discard of that, as well as the gloves, and dispose. Okay, next we will get our sterile gloves. Okay, that thumb is gonna be stuck. And then we'll, this one here. All right, we will discard that. Next, we will get our supplies set up. Okay, so next we will grab our inner cannula, get our brush, dip it in the solution, and we're just gonna clean, ensuring we get all of the crust and secretions off of here. We're gonna dispose of the brush, place this back in the normal saline, and then we're also gonna place our cotton swabs in the solution. Okay, so normally this is done with 2 people, one person doing the procedure and the other doing keeping the trach stabilized and secure. So as you remove that, you want to kind of check for infections or skin breakage or any type of issues going on, if there is any. All right, so next we're going to clean around the incision. So you're going to take a swab, clean, dispose, clean, dispose, clean, dispose, clean, and dispose. Okay, then we will take a gauze and you just kind of want to pat dry around the area and dispose. Then we will get our inner cannula, place it back in there, lock and secure it. And then next we are going to change the tie. So when doing this, you want to make sure you're securing the trach. I'm just going to have to lift up here a little because my stand is a little off just to remove this. But you always want to make sure you're stabilizing the trach. Okay, I'm just gonna lay him back down. You want to make sure you're holding that and dispose. You want to grab the other one gently, make sure you're securing the trach and dispose my string. Okay, as you're holding that, you want to grab your new string tie. I'm going to use the one tie method. Make sure you're stabilizing your trach. And when doing this, you want to make sure you don't have any ties or twists, just to ensure you are avoiding skin breakage or irritation to the patient. Again, I'm going to have to lift up here because I don't have the best stand. Come around here. You want to make sure it's nice and secure. Lift the 2 fingers. Again, you want to make sure there's no twist in there. Still securing the trach. And you can also have the patient assist you if you don't have help. Okay, then you're just gonna do a tiny knot. Again, you wanna make sure you can get 2 fingers under there. Okay, so you can cut off the excess string, but we're gonna get a gauze to put under here, just so there won't be any skin breakage or irritation for the patient. And typically you will tape down the excess string in the gauze. I don't have any, but you want to make sure the tape is not on the patient's skin. All right, so next we are going to gather our trash, dispose of that, perform hand hygiene. We will then lower the patient's bed back to their comfortable height, put the patient in a comfortable position, make sure the patient is stable and comfortable. If they have any questions, make sure you know it's not irritating them, and then we will document, and that's it.